Yes, I think we're good. So welcome everybody. Another version of Shoetopia live here today. And an absolute pleasure to have uh, Kelley Eves with me today. And Kelly's a footwear nurse. And we're going to, as I mentioned, for those of you who got the email last night, we're going to go through all good things. May is Foot Care Month. And so Foot Health Month, right? Yeah. So we're going to carry on some conversations all about that good stuff today. One of the things I always like to do is start off our Facebook Lives with just a word of gratitude. And if you'll allow me the opportunity here, Kelley, I just want to say thanks to our customers that have supported us over the last few days. And I mean, I'm just looking through a couple here now. Kevin just made a purchase on our web store 14 minutes ago, it says here, for a pair of Birks. Philip, Shelby, Colin, Jennifer, Donna, Shannon, Lori, Carolyn, Jan, Lisa, Judy Ann, Jackie, Julie, Sherry, Daniel, Amanda. So we've had some great people reaching out to us and supporting us at Shoetopia through this downturn, and I'm really very grateful for that. I'm grateful right now for the sun shining and it's feeling up. I mean, it's a little bit cooler, but it's starting to feel like spring. And some of the stuff we're going to talk about, Kelley, is getting your feet ready for spring and summer. Do you want to start us off with that sort of framework? It's feeling good and we're getting ready and taking off the socks a bit. And why don't you first tell us about your business and get into that a little bit, what you do, where you're from, and then we'll lean into getting ready for spring.
All right. So I'm a registered nurse who has been doing this a lot longer than my hair would let you know. And I was a diabetes nurse at the family health team in Fergus, Laura Arthur. And that really got me interested in foot care. I always knew it was really important for people with diabetes, but as I was working with those folks, I thought, I don't know where to send these people aside from the chiropodist who was affiliated with Grove's Hospital in the area. So what else was out there for people to avail themselves of in regards to foot care, and where were the quality places to go and get good foundation footwear? So, of course, always when you work in Fergus, Laura, you would send people to Shoetopia.
We try.
And yeah, and I was just over the moon delighted when Mount Forest opened some too, because I actually live in Mount Forest. So I have many colleague foot care nurses who serve the Fergus, Laura, Arthur areas. I mostly focus on Arthur, Mount Forest, North Perth, and Southern Grey. But there's always somebody who can help you if you have foot problems. I think most out. There's someone who can help you be more. I think that's something we have in common, Peter.
Yeah.
So I don't know what the most common things you would hear about are in terms of discomfort, but a lot of times people have developed problems with their feet because of their footwear choices. A lot of corns, calluses can develop because you're not wearing the right shoe for your foot. And we've, through the mass production eras of time, come to a place where we make our feet fit the shoe instead of making sure that the shoe fits the foot. So that's one of the reasons why I always send people to a reputable footwear store, as opposed to just saying, go into the store and sit down and try it on. There's the first thing that people should be aware of, I think, when they go to shop for shoes. What do you do in shoes? You don't sit in a chair, you walk in them. So you
We
need to
certainly
get,
we certainly encourage that at our store. It's like,
yeah,
hey, stand up, get around, do a
yeah,
few laps of the store.
yeah. It's got to feel good because the mechanics of what you're doing when you walk is what that footwear is going to support. So you need to know it fits your foot. There's arches, there's widths, there's lengths, and footwear manufacturers have to make one size fits most. But a lot of the very good brands will allow for modifications, and that's where some of the other foot care professionals might come into play.
Yeah, like if listeners of our show here today know that I often do, we have a whole series with Laura from Align Pedorthics called Feel Good Feet. And that on that side of things, we talk about all of that sort of professional side of things and the orthotic ends and the builds on the different shoes and some of that sort of stuff,
Yeah,
you know.
yeah,
And, often we overlap when we're talking about some of the stuff with what it is that you do. And
yes.
so it's nice to have you on board today so that we can kind of go through. Like typically, when you're going to see customer, what is it that you would do? Because often your stuff is in home. Am I right?
That's right. My philosophy is that sometimes the people who don't reach out are the people who maybe can't get out, or there's a lot of people that think my feet are so bad that I'm beyond help, and that's just not true. Um, Everybody's feet can benefit from foot care, even if it's just something you're going to do yourself moving forward. Sometimes just having that objective third party look at them. So what I usually start is either with a foot bath or a cleanse of some kind. I have some products that I like to use. And once I've cleaned your feet, I'm going to check your pulses. And if you're diabetic, I'm going to check your sensation to make sure that you don't have a common condition called neuropathy. Neuropathy doesn't exclusively live in people who have diabetes, but it is very common. So we like to get that on record so that we know that you are actually having what's called protective sensation. So that's the thing that tells you my sock is folded in my shoe, or there's something in my shoe.
A
And
pebble or whatever. Yeah.
that gift of pain is sometimes not there for people with neuropathy.
Okay.
Neuropathy can also arise from chemotherapy, and sometimes people haven't been told that. So they need to be aware that foot care might become more important during or following cancer treatments. Some medications can contribute to neuropathy, sadly, but it's knowing and being an informed consumer is the best defense against getting trauma to your feet that is preventable through good footwear choices.
Great.
So then after the cleansing and the inspection, then we go on to do what you'd expect. We trim your nails. And we also, as we're looking at that, are looking at the condition of the skin. Is it overly dry? People with diabetes in particular tend to have, as part of the nervous system involvement of diabetes, they tend to have excessively dry feet. So one of the things we have to be cautious in educating people is, yes, you do need to moisturize, but you never encourage people to moisturize in between their toes, because a lot of people's toes are really tight together inside their shoes. That can trap moisture and actually end up giving you a form of fungus skin infection, commonly known as athlete's foot. But it can be known by other names too. And that's really uncomfortable and miserable, and no one likes having it.
No.
So no cream between the toes. And when you do your own baths or showers, make sure you dry between the toes. Really, really important for everyone who's got tightly packed toes, but mostly for the people with diabetes.
I liked that you sent me a couple of sheets of information just regarding this conversation we're going to have today, and I liked your answer to who needs a foot care provider? And you
Yeah.
said, in my view, someone who can't see, can't reach, or can't feel their own feet.
Yes, that's absolutely true. And that's the simple coaching that I give to folks. If your vision is impaired, and let's face it, as we have more birthdays, our vision doesn't improve. Your feet are not getting closer. And if you're having trouble seeing them, it's not for you to be taking sharp instruments to them. So reach out and get some help. If you can't feel them, of course, talking about neuropathy there, but reaching them, that's a bit of a problem. If you have bad knees, bad hips, a bad back, or you've developed a little paunch, and that's not easier as we have more birthdays either. You need to be able to have the dexterity in your hands to manipulate the instruments needed for foot care to do your own nail trimming. Now, most people, and there are modifications and devices that you can use, who can't reach to get cream on their feet, but there are devices you can use or things you can do to be able to do that, because that's one of the most frequently skipped and important things about your ongoing preventive maintenance, is making sure that you're getting some kind of an emollient, moisturizer, cream, whatever you've got that you will put on to keep the skin on your feet healthy.
Yeah, you know, and I had asked in our email last night that I sent to everybody about this conversation if people had questions, and there was a few questions that came in regarding that. And one of them from Christine came back and said, "What's the best way to keep your feet and nails moisturizer?" She says, but I'm assuming moist, or what moisturizer would you use? I'm not exactly sure how, you know, but essentially that was sort of one of the questions that was brought up. Do you have a preferred, and I'll just assume that she's looking for a specific moisturizer or something like that from that question. Do you have a preferred thing, or is there something that contains a certain element that you're suggesting regularly that somebody would look for in a brand?
Well, there's lots of great brands. In my practice, I usually use products called Footlogix. They were developed by a podiatrist, and so they are actually a line that does include some lotions, but includes a unique formulation that has foot foams. And they design many different foot foams for many different kinds of foot issues. So the nice thing I find, I recommend these to the fellas because it's kind of like pumping shaving cream out into your hand.
Yeah.
They disappear quickly, don't leave a greasy feel. Because
Nice.
for a lot of the fellas, let's face it, they don't want to smell pretty and they don't want slippery. So that is something that they can do as part of their daily routine of, you know, I put this stuff in my palm, I get it on my feet, and I pull my socks on and away I go. So
No,
that's one of the
great.
things that I have recommended. Now, usually where we're talking about lotion, I don't really go too much for lotion other than following foot care to do a massage, just a relaxation massage. I'll use a lotion for that. A cream or a balm. Flexitol has some really good products that you can pick up in the drugstore that are super, super rich if you tend to crack. That's starting on the heels and just let it go wherever it goes besides between the toes.
Yep.
But Flexitol is a good brand too. Anything if you have a lot of callus that has urea content. So Urimol is a brand, Eucerin is a brand, but it's just, you can talk to the pharmacist. They may have stuff behind the counter. If you've got really, really hard heels, you need to sock it to them with the cream.
Yeah.
That's the best preventive maintenance you can do.
With your products you first mentioned, is that a line that you actually carry, Kelley, or?
I actually don't, because I have a dependable retailer here in town, and also in Arthur Walsh's Health and Lifestyle Center.
Okay.
So they carry all the Footlogix products in both the drugstore and the Lifestyle Center.
Perfect.
So if anybody asks me, where can I purchase this? That's where I send them.
Well, that's what I'm asking. So
Yeah, because
that's great. I mean, we're here to support other local retailers too. It's good.
for sure,
We're a
yeah,
community, right?
yeah. Some spas carry the Footlogix product. It's not the only
Sure.
formulation that comes in a foam too. There are other ones that other clinics and podiatrists, chiropodists may carry.
Yep.
But personally, I'm selling comfort. I'm not selling products. So
Yeah. Right.
that's what I try to encourage people to make their best choice
Great.
from local retail settings.
That's awesome.
Yeah, and
Yeah. Great.
everybody can afford the expensive stuff. So if you're going to go into Walmart or wherever, then go to the pharmacy and say, what products contain urea, for example, if you've got the callousy heels. And sometimes the stuff that's behind the counter is really, really reasonable. And the stuff that's being touted as a foot lotion or a foot cream might not be.
Yeah. Cool. Well, that's good information for sure. What specifically, we kind of started off by saying we'll get into some of the stuff about how to get your feet ready for summer. And I mean, that's obviously one of the things. If you have hard heels and you want to get, ready to roll and expose the feet a little bit and what have you, let's roll through a little bit about as it's starting to feel warmer, what kind of good things can you do after a winter of being cooped up and wanting to unleash the dogs down there?
Well, yeah, for sure. Because we're all being deprived at the minute of being able to seek someone like myself, other than in a very urgent situation. We would hope that we can all get you back to seeing people like a reputable pedicurist or another foot care nurse or a podiatrist if that's been your custom. But at home, you can do little things like just the daily moisturizer. If you have a pumice stone, that's a great thing to do in the shower or in the bath. We don't recommend foot soaks per se, but if you're going to try something, there's been really good valid research on apple cider vinegar
Hmm.
for improving the condition of the feet, because there is an acid mantle on our skin, and sometimes things will get out of balance with all of that enclosed space. So you can either buy a little bit of apple cider vinegar and put your feet in it for maybe 15 minutes and do that for a couple or 3 days in a row, and then just spritz a little on your feet occasionally. It's been touted as doing really, really good things for the skin. And so we need to make sure that we're not doing excessively long soaks in hot water, because that actually doesn't do good things for the skin. We want to do no more than your typical bath or shower exposure to water. And if you're using soap, something really, really gentle, like Dove baby soap is one of the ones that, or anything that's got that moisturizing component, will be better than a drying soap like bar soap. Plus, you put bar soap on your feet in the shower, you're going to fall. Don't want
Yeah,
that.
exactly. Gosh, no. And
Yeah,
nobody needs that.
yeah. Yeah, the pumice stone is a great thing. Most people, make sure you're not sharing it with other people in the family, though. You want to have your own pumice stone.
That's a good point.
Yeah,
Because I
yeah,
mean, let's face it, a lot of people share the bathroom, right?
yeah, absolutely. And if you have something like athlete's foot or fungal toenails, you can share that with your family, and I don't think they'd like that.
Not so much.
So, yeah, another common thing with people who've got fungal problems is that it will clear up a little bit when you've been not having them in the closed-toed shoes and boots. So summer is your friend in that way. It can be also a friend for ingrown toenails as we get the toes out, not cramped into those too narrow toe boxes, and sliding into the ends of shoes and boots. So that's another great thing about summer.
Yeah.
Let them
So,
out.
you know, Lillian asked a question and she said, can you talk about ingrown toenails? Is there anything I can do for the pain until I can go for a pedicure? because
Yeah.
we're dealing with this stuff where you can't come into the home and we can't go to our normal practitioners and we can't get the help that we need. So how could somebody like Lilianne deal with the ingrown toenail that she currently has, and what would you suggest there?
That's the toughest thing ever. People who have a tendency towards ingrown toenails are just in misery when they get to the point where they are ingrown. And there's certainly, I mean, there's lots of old wives' tales, and I bet you most people who have been through that have really suffered tremendously trying to get their ingrown toenails not to be ingrown. The gold standard, I find, is to go and see a professional chiropodist or podiatrist. Get their recommendation. If it's a chronic recurring problem, you could probably either benefit from a surgical procedure or the application of a nail brace. Much like we get our teeth braced, there are nail braces that can correct the curvature and the growing in at the corners.
Wow,
So
I didn't know that.
that's a relatively recent option.
I'd never heard of that before.
Yeah, but it's got a specific certification. So usually there are some foot care nurses that do it. And it's like getting braces on your teeth, not inexpensive,
yeah,
but it beats having part of your nail hacked out, which is the surgical procedure that you might be offered if you go to through your family doctor and see a general surgeon. They will say, well, we need to do something called a partial nail avulsion, which basically cuts down the side of your nail. And sometimes that's effective. Some people have had that done and really said, I'm glad I did it. I don't know why I waited so long. But the nail bracing is less invasive and more aesthetically pleasing as the result. May need to be reapplied 2 or 3 times, but hearing really good results with that.
Is that something you do?
No, not yet. Maybe sometime, but it's relatively new. Within, I want to say, the last year that it's had Health Canada approval. And so the training is really just kind of rolling out for foot care nurses. But podiatrists are certainly embracing that as well, and chiropodists.
So in the meantime, before she can go back there, is there anything she can do sort of at home to help this?
Yeah, so you want to keep the skin there as soft as you can. Part of it is the nail growing down into the side of your nail. And part of it is that gets calloused and really, really hard. So there's lots of pressure and sometimes infection. So applying a really good moisture cream that's very rich to keep that skin supple will reduce the pain. And another thing that you can sometimes purchase at drugstore, pharmacy, is something called an ingrown toenail file that allows you to gently get in and just kind of encourage the corner of that toenail out of where it's digging into.
That's interesting. So it's like a little hook?
It's almost like a little tiny end of a file. It's only millimeters wide.
Okay.
And to get in there, you can sometimes lift that corner out. Some people will actually try and get into that corner with dental floss. There's YouTube videos about getting the dental floss in there and pulling that toenail out. But the bottom line is, if you've ever had a hangnail on your finger, an ingrown toenail is very much like that. There's that hard piece of nail that just is in there, and that little spicule, as we call it on the feet, is what you need to get a hold of with that narrow file and just sand it off. So it's not growing there and creating so much pain. It can be a real emergency. If it gets infected, you need to be seen. I don't care how much of a wimp you feel like you are. If it's red, inflamed, swollen, and you see anything like green or yellow drainage, you need to see your doctor, because you probably need more than just polysporin ointment. You may need an oral antibiotic.
That's great advice. Great advice. I have another question here, and a couple. One's for me and one's for you. Marie says, I have a question for Kelley. What treatment do you recommend for toenail fungus?
Another tough one. Not everything that looks like toenail fungus is toenail fungus. So usually start with the conservative measures. There are topical things that can be tried for very superficial fungus. A lot of people have had good luck with some of the essential oils. So applying things like tea tree or melaleuca oil to the nails. Following good hygiene practices, obviously, because if we have fungal nails, we're in a continual process of reinfection because fungus sheds spores, and those spores are tough to get rid of. So you want to be doing things like making sure that you are washing your socks in hot water, maybe with a little bleach if they're white. You want to make sure that you're changing your bed linens. If you have athlete's foot, this applies too because it's also a fungus. You want to be making sure that you're not sharing shoes, that you're not sharing foot files or pumice stones, and that you are looking at the inside of your shoe. And some people will actually Lysol the inside of their shoes, or pop them in the freezer, because those are some of the things that you can do to get rid of that fungus.
I've recommended the freezer trick before, for sure.
Yeah, for sure. Yeah. So the other pieces of that puzzle are, not reinfecting yourself, but you have to be consistent. There are everything from those essential oils to the over-the-counter stuff, right up to prescription medications orally and topically. There is a good one called, there was Penlac. I think it's kind of gone away because it had to be taken off once a week and reapplied. There's one called Jublia that you can get through your doctor. But it's important, if you're going to talk to your doctor about it, that you recognize two things. They're probably going to want to do a fungal scraping to confirm that it is in fact a fungus. Before we treat with an antifungal, we want to confirm that it is a fungus.
Okay.
Makes sense?
Yeah.
The Jublia needs to be applied daily without fail. Takes, for especially a big toe, and those are often the most affected, it takes about a year for the entire nail bed that's under the skin that you don't see, for that piece of nail to grow out. So your commitment is going to be daily applications for a year to make sure that you get a complete cure. And they don't always get a complete cure, but if it's that bothersome to you that you want to have that level of commitment, prepare for a year-long ride.
And that's okay, because everybody, everybody has different ideas on what they want, right? So, and if they are willing to commit to that, then good,
Yeah. And you'll definitely have healthier nails. There's no doubt about it. It's often misperceived as really just an aesthetic concern, and some estheticians will just paint over it for you.
Yeah.
Not what I recommend. Traditionally, foot nurses are anti-paint, but I'm here to tell you in the summer there's paint on my nails.
Let them breathe, right?
Yeah, let them breathe. Let them be healthy.
Yeah, and I think those are great things. I mean, I want to get back a little bit later to the idea of socks and stuff like that too, and some other things. But one of the just to finish off with Marie's question, she had asked if we carry wide fitting shoes for ladies, and we carry certain widths. So with wider widths, we carry usually up to a 2E width in New Balance on a couple of different shoes, but not a whole lot of 2E widths. So in ladies sizing, B is sort of a medium, D in New Balance anyway, B is sort of a medium, D is your first width, and a 2E is your second width. They actually carry a 4E width too, which we don't stock for ladies, but we can always order stuff in those widths. And on the men's side of things, we do carry a couple of shoes right up to a 6E width. So we are basically, our stores are basically, we fit more wides than we do narrows. We really have got away from carrying anything narrow. The demand hasn't been there for us in the markets that we serve. So we really don't carry a whole lot of narrow stuff. We really do carry more sort of medium, first wide, second wide, and some into the third wides. But Marie, if your daughter needs wider width than we currently have in the store, we're always willing to work with you. It will be something that we need to bring in, but that's okay. We do that sort of stuff for our customers at Shoetopia, and there's no issue there. One of the things that I wanted to, I have one more question here from another customer, and I want to get through all of our questions that we had for sure in our conversation here today. It's Robert, actually, and Robert says, appreciate you doing this through the COVID-19 fiasco. Can you talk about why it's important not to go barefoot in the house?
Well, if you have diabetes, we always preach to people, and preaching isn't always well received, is it?
Well,
We
no,
always
not.
preach.
It's always a choice, right? Everybody has a
Yep,
choice.
that's right. But footwear inside and out is a good idea for everyone. And sometimes it's just about, you know, geez, I'm in a hurry, or I know that my house is safe. But let's face it, we've got kids, we've got dogs, and I don't have kids, but Lego is not comfortable if you step on it. The other thing I know is I have dogs, and my dog has bones. And when I step on his bone, I feel that. If you didn't feel that and you didn't feel the injury, imagine the discomfort. People who have diabetes in particular, but just with neuropathy, don't always feel if there's something in their shoe, right, or if they've stepped on something. So some of the stories I've heard, you couldn't possibly believe unless you were actually speaking to the teller of it. But this is one of the reasons why we always encourage people to wear good footwear inside and out. So you may have inside Birkenstocks and outside Birkenstocks in the
Sure,
summer.
we see that a lot. We call it a migration.
Yeah.
So your new ones come inside, and then the old inside ones go to sort of every day, and the old everyday ones go to like cutting the lawn and doing all that other stuff.
Sure, sure. Even a decent quality slipper. I know I have a pair of quality slippers that were bought at Shoetopia in Ferguson. I'm thinking it's like 20 years ago now. Still going strong.
Yeah.
And those are the first things that go on my feet in the morning. And I won't say that I never go just sock feet, but we've got hardwood floors, and one of the things I like is my comfy good slippers.
Yeah, I'm with you. And I mean,
yeah.
I wear sandals in the house a lot at this time of year. I like my Mephistos, so I wear those a fair bit in the house as my slipper, but it's a sandal. And in the winter, I often wear a glare up, which is a wool slipper with no support, but I slide in a formed arch support that I like wearing, and it gives me a bit of support in my slipper that I love to wear. So I mean, everybody can modify and change around what they like, but I'm kind of with you. I like to have something on my feet when I'm in the house as well, because we, for the most part, although this room I don't, but for the most part, we have hard substrate floors, and either tile or hardwood, and I just like to have a little bit underneath me there, because I'm even as I'm standing here today, I'm using a stand-up desk. I stand a lot, so I want to have that foundation under me, giving me the support regularly in my house as well.
Yeah, and it can help with the multitude of issues, right down to back pain, knee pain, hip pain. It's what you're standing on that's where the rubber meets the road, literally. So you want to make sure you've got the right thing on your feet. And I was interested when you were talking about Marie's question around shoe fit, because there's a variety of different things that people sometimes forget about. They forget that their feet change as they age.
That's a really interesting point, because I've always been a 7 AA doesn't actually mean you're a 7 AA.
Exactly. And every shoe made is a little bit different. So, you know, if you had that person who came in, I would hope that the first thing that we would do is like, well, when did you last have your feet measured? Because we need to know, first of all, do you have a narrow or a wide foot? And where is it narrow or wide? And, you know, what kind of an arch support is it that you need? Because people can walk with their feet sort of rolling in, which is called a pronator,
Right.
or rolling out, which is called a supinator. And they both need different styles of support
They
for
do.
that particular issue.
Yeah, I mean, we talk about that a lot on our Feel Good Feet stuff with Laura, for sure, you know.
Absolutely. Yeah.
Pronation and supination is talk in our stores every day.
Yeah. And if you're in the wrong shoe and it's making things worse instead of better, then of course you're not going to find them comfortable and they're going to sit in the closet. If you're going to invest in good footwear, you want it to serve well. So you want to make sure that it was measured to fit your foot and that it's going to mechanically support your gait, the way you walk.
Yeah, for sure. Getting back to socks, we were going to talk a little bit about socks. You had written socks in summer, and I also wanted to get your take on uh, the actual materials that you think are good for socks. I mean, my opinion, and I'm wearing them right now, I wear wool every day, year round. I just like merino wool as my sock. 10 years ago, when I came into Shoetopia and we took over our store in Fergus, I had never wore a pair outside of just, you know, hand knit wool socks. I had never wore a pair of merino wool socks before. I was always a cotton sock wearer, or poly even, because I just didn't know the difference. And now that I've been into merino wool socks, I just don't wear anything else. That's all for me. That's all I like to wear. I think they're just awesome as far as wicking away the moisture. They're naturally antimicrobial. I mean, all the good things about wools I really like. What's your take on socks and bamboo and the different materials and what do you usually recommend?
I just, I'll insist that people wear them. That's the first thing. um, I know nobody likes socks and sandals, and that's maybe one of the exceptions you could make. If you've got a good fitting sandal that doesn't cause you any blisters or rubbing, then maybe you can get away without it. But I see a lot of times in the summer, people will say, well, I can't wear socks in my sneakers, my feet get too hot. Then you're not wearing the right kind of a sock. You need to experiment. And a lot of people are pretty cheap and they want to wear the cheapest sock, but sometimes those natural fibers breathe so much better.
It's
Um,
amazing. I find it just absolutely amazing.
yeah, and if it breathes, it's more healthy for the skin on your feet. So that's a really important thing, is to make sure that you're doing the right choice for the sock in your footwear as well, to promote healthy feet. You know, it's some people have to wear things like support stockings and
Yeah,
stuff
for
like
sure.
that, and that, I know that's tough too.
Yeah.
Um, but once you benefit from a supportive hosiery, you're not going to go back. Let's put it that way.
I would never, you know, 10 years ago I never would have thought I would pay $25 for a pair of socks. And now I'm saying that's all I want. You know, I don't want to even go back ever.
Yeah.
And you know, one of the interesting things, and I wasn't gonna talk about this today, but now that we're on the sock line, just before we closed, we got a great new line of socks, which aren't merino, by the way, but are supportive socks. They're called Feature socks. And Features actually has all sorts of built-in supports. They actually have a plantar fasciitis socks that has tensioning, sucking up into the arch and wrapping around the heel as well. All the pressure points of the sock, it just sucks up and really supports your foot. So there's a couple of really interesting supportive socks that they have individual arches, the right and the left, so that it's giving you the arch support that you need in the sock itself. So I'm really excited about this new line that we have for some socks too, which are, you know, technical socks really. A lot of
Excellent.
Features began as a running brand for runners, but they've really branched out now and into sort of everyday use and stuff like that, because a lot of those features of the features are stuff that people just want, and they want to have that support in their sock. And most people are saying, oh, I wear tube socks, so what are you talking about support in a sock? But it's amazing when you put one of these socks on, it's like, wow, I can really feel that, you know?
Yes, I agree. I have tried some socks with additional features,
Hmm.
and the ones that I tried, I wasn't particularly fussy on, simply because for the price they wore out really quickly. Maybe it's because I wore them a lot though,
Right.
but I'd be excited to try what you've just got into, because I have plantar fasciitis and it's not fun.
No, it's
Um,
not.
so I
We
think people who have it will try almost anything to get rid of it,
yeah.
and never underestimate the importance of that good supportive footwear. And the sock, sure, you bet you I'm going to try it.
Yeah, well, like I said, we were ready to launch it as like when we bring a new brand in, we'll launch at Shoetopia, and we literally have the walls set up in our store, and we closed like the next day. So we didn't never got around to actually launching the line, but we will, and it's there and it's ready, and you know, so there's some neat stuff from features and some great other sock lines that we carry too. But
Super.
that's interesting. What else are we going to talk about here today, Kelly?
Oh, geez. I'm not really sure what we haven't covered that we should. We've talked about lots of stuff. We've talked about why the shoe fit is so important, and how we really need to make sure that the shoe fits your foot and you're not making your foot fit the shoe.
For
That's my
sure.
biggest issue, is when I see trauma that's been caused by ill-fitting footwear. I
I had a lady was talking to since the closure, sort of back and forth regarding her regarding her bunions essentially, and
right.
she was talking about the fact that, you know, she thought her bunions came from the Birkenstocks that she's been wearing for years and years and years, but you know, typically we see bunions and stuff coming not so much from flat shoes, you know. Um, Typically they're more from sort of heeled shoes, and where you're, you know, it's more of a function of how your foot's laying in and what's causing it to move out. And typically it's not something that's sort of from the flat perspective, although your feet can spread out, obviously. But there's just a lot of different things on how the footwear either creates the structure of your feet over the course of time, or creates what you work on, which is the outside, the texture, the skin, the all of the different you know, sort of fleshy parts, let's say.
Yeah. Most of the time, you're right about the what we've worn in our youth will come back to bite us in the butt as we have more birthdays.
Yeah.
Um, so the people who worked in an office and worn heels, and the perception is, I'm a short person, so I was like, well, I'm wearing the heels because I want to feel taller. But if you ever look at an X-ray of a high-heeled shoe on a lady's foot, you will never put one on again. The torture. We think it was cruel when they bound feet. Well, I'll tell you that those high heels are really cruel. Those are for special occasions only. And please bring your flat shoes too, because you know you want to dance.
Yeah,
Um,
exactly. You know, we want to look good, but at the same time, we want to feel good too. And I mean,
yeah,
that's our motto at Shootopia, right? Is look great, feel fantastic. Where's the
absolutely.
medium? And that medium is based on people's perception. And people will come to me and they'll say, well, I don't want something that looks ugly. Well, looking ugly is a perception that you have that might be very different to somebody else. And
Yeah,
that's one of the
exactly.
things in the store that we have to cross all the time. It's like, well, I don't want, like, what is your perception of looking ugly? And so that we can work through some of that sort of stuff. It's interesting,
Mhm.
the different businesses and how we adapt, because everybody's perception of what they're looking at is their perception, not somebody else's.
That's right. I mean, somebody will go in looking for a fancy dress shoe, for example. And, you know, you want to buy something you're going to get a lot more wear out of. I remember a colleague of mine whose daughter was getting married, and she ended up going looking for shoes for the wedding and ended up with a pair of Mephistos with bling on them. And they were great for the wedding. And then she wore them so much after. We just were like, I love those shoes. They're just so sharp.
Yep.
And yet they were so comfortable. So, you know, I think that that's where, you know, the stiletto heel, okay, maybe you're going to wear it for the ceremony, or
we see it a lot. I mean, we don't sell high heels for the most part, just because it's not our specialty, and you kind of have to have a really good selection for people that are looking for that kind of stuff.
Right.
And because it's not our specialty, we don't do a whole lot of it, but we do certainly see the, let's call it, after party shoe.
Yeah, good.
People are kind of coming, I got my high heel, but now I want what I want. And that's an interesting thing.
Yeah.
Sure.
But bunions are also very much a function of biology. And I'll bet you if your customer who's asking about bunions and thinking that the Birkenstock allowed it to grow, yeah, it probably didn't contain it.
Yeah.
And there are bunion correctors that can be used in the early stages of a developing bunion.
Yeah.
But if you look at your mom and dad and your grandma and grandpa and your aunts and uncles,
so
chances are
the case. Yeah,
they're
just heredity. Yeah, for sure.
Yeah.
Kelly,
and we can't pick our parents.
In the sake of time here, I'd like to sort of start to wrap this time up, and I want if you could do our customers and our listeners here a favor and let them know how to get a hold of you, all of your good contact information and all that stuff, so that if they need to get a hold of you. And you also mentioned maybe having some people down in the Fergus sort of area that you may be able to refer as well. So if people want to get a hold of you, would you be okay to get back to them on who you might refer down in the Fergus area as well?
Absolutely.
Yeah. So if you want to give us all of that good information, your website, your email address, your Facebook page, all that kind of stuff, so that they can, you know, follow up with you.
Absolutely. The easiest way to get a hold of me is either by phone or my Facebook page. And you want to search for Caring Soul. And it's just one soul, not two souls. There is another foot nurse in the area who is Caring Souls. And if she's accessible for you, by all means, you go for her too. One of the best repositories for the listings of quality foot care nurses is the Waterloo Wellington Diabetes website. So if you put that in your Google search tool, they're out of Langs Farm in Cambridge. But they're the regional coordinating center for diabetes. So they are able to, even if you call them and say, you know, but you can find it on the website there if you want to do that, or you can call them. They also do a great, and we're hoping to do it soon, perhaps by Zoom, is a program called Pep Talk, Diabetes, Healthy Feet and You. And that's got lots of good self-care information, and we're always looking for people who are keen to spread the message about how important foot care is for people with diabetes. So yeah, check my my Facebook page out, Caring Soul. My
and your phone number, you didn't give it your phone number.
Is 519-820-7187.
Perfect.
But 519-820-7187. That's my cell phone, always with me. You can text me if you like. And my email is the word "the" followed by my surname with no punctuation, EVES, theeves@whiteman.ca.
Perfect. Well, that's great. Do you have any wrapping comments here today, Kelly, as we kind of wrap up our time together?
I'm a country girl, so I'm not going to wrap. But I think the biggest thing is who you see, if you do it smart, is less important than the individual choices that you make in between visits. So I'm dying to see the person who does my pedicure, and can't wait to get some paint on these toenails. But in the meantime, be kind to them, get lots of moisturizer on them. If you need to file them, go for it. This will end, and you will be able to go and get your feet looked after, and do that favor for yourself. Treat yourself to a visit with a foot care provider, podiatrist, chiropodist, esthetician. Just be sensible. Make sure that you're inquiring about how they clean their instruments. Make sure that you're comfortable with their knowledge base, especially if you have circulatory problems, arthritis, diabetes, or you're immune compromised. You have every right to ask, how do you clean your instruments? Sterile instruments are required for foot care. So that's an important thing to ask.
Yeah, that's a really
and
good point.
Feel like you have the right to know what they're using on you. You do.
No, that's great. Well, thanks so much for spending some time with me and with our audience here with the Shoetopia network. And I really appreciate it. It's been fun, and I've learned a lot today. So really appreciate your expertise on this. And hopefully we'll be able to rejoin again for another conversation on foot health down the road.
I would love that, because there's
Sounds great.
nothing, it's my favorite subject.
Right on. Beautiful. Well, it's mine too.
Yeah. All right.
So thanks very much. And again, we'll talk sometime down the road, and hope you're stay healthy and have a great day. Enjoy some sunshine.
All right. Well, thank you so much for having me.
Right
and if there are any questions that come up as a result of our chat today, I'm happy to get back to those people as well.
Perfect. Yeah. So if anybody missed any of the information, just email me at peter@shoetopia.ca, and I will certainly relay it.
All right. Thank you so much.
Bye-bye.
Bye.